This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning. Welcome to the show. As we always like to say, it's time to get healthy. And the next hour is the time, and this is the place, and you've got the right place. Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPH.D. And as you heard the man say, Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. Boy, do we have some good information for you today here on the show, as we do each and every week, so stick around. And, of course, if you have a question for Dr. Molly, 855-839-1210 is the number. 855-839-1210, the number right here in the studio. You have a question, you have a medical challenge, or just simply want to know more, well, this is the time to call in. 855-839-1210. Health Watch every Sunday, 8 till 9, Talk Radio 1210. WPHT. It is a good day, Dr. Molly.
Well, it is, even with a little rain.
That's
and,
right.
You know, we had a beautiful day yesterday. I hope everybody got out for their walk and that kind of thing.
There are many things that Innovative Medical Associates does.
Yes.
And a lot of people listen to us, and they still kind of don't get it completely.
It's hard, John.
Yeah, it is hard. So we like to do this every week to go over it. So it's sort of like the professor. Remember in school?
Yeah,
in case you missed it last week.
Right.
Here we go again.
Right. And you know what it is, John, too? Our website, of course, is Innovative Medical Associates, which is the cooperative. We are a cooperative group of healthcare providers who are operating out of my facility, which is a primary care licensed facility in Marlton, New Jersey. And I was lucky enough to put this group together, and we are like-minded in how we want to treat and help people.
And it is different.
Very different.
We have often said that, and a lot of people say, well, what's different? Like I was telling somebody the other day, I said, well, you know, I go twice a week and I get these. And then after I get to the vitamin C, I'm thinking, all right, do they really understand?
Not at all.
No,
not at all.
Understand.
Not
so
at all.
It's like,
people come in and they're amazed to see our hydration in action.
Yes.
So that's the key. What we do is we are primary care, as I said earlier, and that entails if you have a problem that you would generally go to your GP or your general medicine guy, family practice guy, we're the place for you. If you have a challenge, we can handle it. But primarily our focus is on maintaining healthy lifestyle, on maintaining functionalness of your life by utilizing hydration as a vehicle to deliver the natural substances that can help you improve the quality of your life. But if you need a pharmaceutical, can we write for it? Of course we can. If you need a prescription to get some ultrasounds or some radiology, does the doc write for it? Of course.
Yes.
Right. So we can do everything they normally do in a primary care facility, except what we don't want to do is give you the side effects of a lot of the things that the primary care guy writes for.
Which is
the
medications,
right,
exactly.
The pharmaceuticals.
Exactly.
So what we do is we like to augment by using hydration as the vehicle. Why do we use hydration as the vehicle? Very simply, when you ingest a vitamin, a mineral, an amino acid, you probably lose somewhere around 35 or 40%. And actually, there was a recent study that said you can lose as much as 60%, depending on the coating of the item. So here we go again. If you're only getting 60% of something, why wouldn't I want to give you a therapeutic value to help augment the 60% of the pharmaceutical that you're going to lose anyway?
Right.
And help you get better quicker.
Which begs the question, do you lose some of the nutraceuticals, or do you lose as much as you do pharmaceuticals?
Well, yeah. There's a lot of data that says it's true. You're going to lose some, which is why many times the prescription says you must take till the end, right?
Yes, that's right.
How often does that happen?
The time.
All the time.
Right.
So you don't screw around with that because you're not going to get the full effect of the prescription med. Now, on the other hand, we're able to give you an IV, which is using hydration, and deliver an appropriate amount of the nutraceutical to augment your pharmaceutical and help you correct your challenge in many cases, particularly with the lipids. I can tell you that absolutely unequivocally. I have the data to support that. And also to help you possibly get out of a viral infection a little more quickly, right? Or a bacterial infection a little more quickly.
And I got to tell you this story. So if you've ever watched Little League Baseball, it's like watching paint dry.
Yeah, kids, great.
My grandson had his first baseball game the other night.
Wow.
And in April, outside at about 7:30 at night,
yeah, cold.
It's cold.
Right.
And I said to myself, back in the day, before Dr. Molly, I probably would have had a cold the next day or two. And you could just feel...
Yeah, the chill.
You could feel the vitamin C and all the things working.
Oh, definitely.
And like within a day or two...
Felt like yourself.
Exactly.
Right. But you were tired. You were tired
yeah,
after my last
That's
little
right. That's
thing
right.
because I hit you hard with some other antivirals because I knew you were in a place with parents and grandparents, even though we're all saying COVID. Listen, this exposure happens to us every day without COVID.
Exactly.
Right?
Exactly. Yeah.
But we're in overkill right now.
All right, 855-839-1210 is our number here. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. We're talking with Dr. Molly Fantasia about innovative medical and about how it's different. The hydration and when you come, because sometimes I hear, I'll see you in a consultation and I'll see you pointing to data, and I'm thinking to myself, good luck, Dr. Molly, because it's really sometimes hard to really grasp it. And so talk about how many times you need the hydration and how often they come in.
It really is going to depend on what you're trying to accomplish. And remember, our focus is on your quality of life and how you're able to function. I like to call this nutritional functional medicine, which means we want you to live the highest quality life you can, whether you have a challenge or you don't have a challenge. And that's really going to depend on why you're coming to see us. We have people come to us, John, who are perfectly fine. They're young. They're in great condition. They're athletes. I just had an athlete that we treated all week who had a little minor surgery, as you know. He had to go back to, I think it's South Carolina or North Carolina, to school. And what we did was we tuned him up with some things that would speed up the healing so that he didn't have to miss his practices when he got back. And again, it was minor surgery. It wasn't anything big, but nonetheless, it has an impact on him. So we were able to tune him up in 4 days, send him back on his way, feeling better than when he came in post the surgery.
And you've had a lot of athletes.
Absolutely. You have them come in who are doing well care, who want to do amino acids, which we'll talk about later, who want to just improve their stamina and also improve the quality of their workout and possibly even the length of their workout and certainly the length of the recovery. More important than the length of time of the workout, the recovery, because lots of our athletes got to go back to their real world.
Absolutely. And I also wanted to mention, and people may not realize this, you and your staff go many times above and beyond when it comes to healthcare. I mean, I guess I got spoiled because when you go somewhere else, it's like, oh, okay, is that it?
Yeah, well, it's true.
Talk about that.
True. Well, it's funny. Okay, we're pretty busy, but we're never too busy to take a moment, and if a patient needs a test or needs some referral or that kind of thing, to discuss it a little bit with them and get them to the right place. But I've got to tell you, when you call these offices today, it used to be that we were able to call those offices. One of the docs would get on the phone with another doc and get you right in. All of that has changed.
Oh, yeah.
It has definitely changed because now so many wonderful physicians have gone the way of really folding their practice into the great monoliths. That's what I like to call them. These great, wonderful hospital systems. And by the way, they're there and they're good. And they're good. But boy, oh boy, the wait time and everything can be extremely long. And so we try to expedite that for our patients the best we can.
I know you've done that. And sometimes you've sent me elsewhere. And it's like, well, we can give you an appointment in 3 months.
Yeah, no, but
doesn't help sometimes.
Well, you know what? That's exactly right. And so I would say that our patients, when they come in for the hydration and they do a protocol of hydration, they then get VIP service. And I think that's where, people
that's the
miss
difference.
it
Yeah,
big time.
You're right. That's the difference. All right, we're coming up on our first break of the morning. Our show is Health Watch. You'll find us here every Sunday from 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, executive director, and founder of Innovative Medical Associates, Marlton, New Jersey. You have a question right now for Dr. Molly? You want to run by a medical challenge, run it by her? You want to ask her about a particular situation that you have? 855-839-1210. And we always tell you, call early because we got plenty of time here on the show, early in the program. But later on, we get some calls, and we can't get to them because it's time to go off. It's pretty simple. 855-839-1210 is the number. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Operators, as always, standing by at Innovative Medical Associates. And they are there right now. So if you are a little bashful, you don't want to go on the air, you want to get more information, you can call them right now at 856-489-0505. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. And again, that's Innovative Medical Associates, Marlton, New Jersey. Health Watch is our show, Sundays 8 till 9, Talk Radio 1210, WPHT. Have a question right now for Dr. Molly. You want to ask her anything about a medical challenge or just anything in general? 855-839-1210 is our number here in the studio. Dr. Molly, we were talking earlier, and what we're going to talk about now kind of does point to how you're different. And what some of the issues are today in medicine in general. And you were telling me about a study at the Mayo Clinic about cancer screening.
Yeah.
And
in essence, everything screening when you think about it. Okay,
what's the
amazing.
problem here?
What they were saying is 70% of the patients who go into their primary doc and actually, talk to them about some kind of challenge they may be having that could be actually a cancer of some kind. Maybe it's manifesting itself, I don't know, maybe with a little pain or something, but nothing specific. So generally what's happening is 71% of these patients don't get any blood tests that really can help the physician point the patient in the right direction for treatment. It's very interesting. So, yes, you get a CBC, which is the complete blood count, which looks at your red and white blood cells and your white count. And, yeah, maybe that might be a little bit elevated, and then he knows you have an infection. You might get a comprehensive, which is comprehensive metabolic panel. That's some of the chemistry, the body's biochemistries, but routine. Nothing really significant if there is a challenge. So we're a little different. When we send out your blood test, we're sending out for things like CRP, which means inflammation. In particular, if we have a concern that you have a chronic challenge, we want to look at things. Your hemoglobin A1C. You know how many patients who, quote unquote, are not diabetics, who I've had people tell me, nurse practitioners and people, actually even scientists in the lab, well, why would you want to do the hemoglobin A1C on someone who's definitely not a diabetic? Why? Because we want to look at the sugars over 3 months. Because why? Cancer loves sugar. Cancer loves sugar. So again, it's thinking out of the box. It's what my docs do. They think out of the box, and certainly as a laboratorian, I think out of the box, which is why I'm where I am and not working for a system. All right?
Exactly. Yeah.
Exactly. How about vitamin D? You know how many people don't get their D level checked now? That's getting better. It's getting better. But still, lots of folks don't. And you know what? You need a high vitamin D level for immune health. COVID has brought that out. Maybe post-COVID now we'll be doing more of that routinely for people. I hope so. But again, these are all insurance issues,
That's what I was going to ask you, right?
Even if the doc wants them, many times
insurance says no.
Right. you have to justify why you're doing these. And the justification process can become very cumbersome for a physician in traditional treatment.
And because he's limited on time,
Right.
so he'll take the path of least resistance.
Right, because he's hoping that the clinical picture supports something that he needs. And again, I want to reiterate something. My docs look at the clinical picture as well. But we're always looking ahead. What's going on before you manifest a problem? What's going on biochemically? And I hope that I have a lot to do with that, because I've seen cases where things are picked up earlier. We do DHEAs, a lot of those, because again, that has to do with your immune system and the adrenals. If the adrenals are fatigued, you're not going to be feeling too well. We might look at all the liver functions. We'll look at all the liver functions. We'll do some of the specialized tests that may not be included in a liver panel, okay? That's another thing. How about we do something like parathyroid sometimes, depending on what the patient is saying? Because if the parathyroid is elevated, maybe that's affecting the D and the calcium. So there are so many nuances for this. Alkaline phosphatase, we do that routinely. We also do thyroids routinely, okay? And that is not done. And I want to thank my doc for that, because always looking at the fact that maybe the amount of thyroid that they're taking or the form that they're taking isn't enough for the patient to really have functionality. All right. So these are the things. And in addition, when a patient comes to us who has a history of cancer, depending on the type, we're probably going to run something called circulating cancer tumor cells. Now, we do the specific cancer cells, the tumor markers. We've done that repeatedly. So if someone comes in, we'll run markers specifically for breast cancer. But looking at those circulating tumor cells, that's the protein that comes off the cancer cell even before you may have a problem. In other words, before you really have a tumor. It's important.
Yeah. Let me see if I can get this straight.
Sure.
The Mayo Clinic did a study and they're saying that 70% of routine visits are basically not getting
full pictures.
Right. And that's due to insurance?
Well, that they're saying that
largely
it's not due to the physicians not wanting to do it. It's because the insurance doesn't pay for it. So why do you think that is? Probably because the standard of care is just that. Yeah. Just the standard of care.
Just do the basics.
Right. Do the basics. And I would believe that is trickling down to all healthcare, not just the primary care guys, but to the specialists as well.
I see that as a big problem, don't you?
Of course, but it's happening. It's happening.
This is where you kind of stand out above.
We try, and we tell people, look, we're going to try to get as much covered as we can. Sometimes we can't, because I can tell you that the circulating tumor cells are not a covered test, and I actually have to send out. It used to be, let me tell you this, 3 years ago, this is not new technology, folks. It's just not routinely given anymore. LabCorp has taken it off its menu. Why? Well, I heard the story that the technology wasn't. No, I read the tech. I'm a chemist. I read the technology. The technology was great. They took it off because they weren't being paid for it by the insurance.
Right.
Okay, and therefore they weren't using it. But I can tell you it's something that should be used, and we have a lab that can do that. Again, it may be a little bit out of pocket. We try to be judicious in what we do. I don't want people to think like, oh my goodness, we're gonna bombard you with lab testing. No. What we are going to do, though, is look way beyond just the standard of care.
What it does say is that you as an individual, not you, Dr. Molly, but an individual really has to get involved in their health care.
Right.
Because here we go. Here's a perfect example of, they're just doing the basics, and maybe you need more than the basics.
Well, I'm going to tell you something else. I, myself, have looked at the spa places that people are going to for vitamin C.
Yeah.
Okay, guess what? They're not doing the blood test to see that the patient can utilize the vitamin C. And that's on a traditional laboratory menu. We run it.
Sure,
okay?
I know you do.
Because we want to see, so it's not just your kidney function. How many of these spas are not running kidney functions? Plenty of them.
Wow. That's significant.
So listen, look, it may be that, it may take a step or two for us to get you to where we want to go with the vitamin C, meaning the amount that we're able to deliver. I mean, we're going to give you a traditional vitamin C bag. That's not a problem. If you walk in and you had too much to drink, called the banana bag, that's easy. That's easy stuff for us. But that shouldn't be enough for anybody.
Again, you really have to be involved, and I mean, you got to do some homework on this.
Exactly.
That's the issue that I see. That you can't just go in and say, okay, I got a test, and then
no. I'm telling you. And there's another thing. There are so many patients who come in, and they come in with bagfuls of vitamins, and they come in with bagfuls of pharmaceuticals. How many of my patients? Just going through that takes my docs some time, all right? Yeah, 3 doctors, no waiting, but nonetheless.
Right, it does take time.
It takes time. And my nurse Barbara, myself, we're always involved. We have a team approach here, and we're not going to let a patient fly by the seat of his pants. We're just not going to do it.
All right, we're at the halfway point of the show, which means we have plenty of time to take your calls here on Health Watch at 855-839-1210. Like we always say, get in here now because, we don't want to miss your call later on because we have to go off the air, okay? 855-839-1210 is our number, 855-839-1210. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D. Dr. Molly Fantasia is here, the PH.D. Doctor, Executive Director, and Founder of Innovative Medical Associates in Marlton, New Jersey. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return. Coming back, more of today's Health Watch after these words. And we should add to that, play WPHT and Health Watch, all right? Sunday morning, 8 to 9. How about that?
How about the replay, John?
That's right. We'll get to that in a moment. Operator standing by right now at Innovative Medical Associates, 856-489-0505. That's 856-489-0505. You want to call, you have a question, or most importantly, you want to sit down with Dr. Molly. You want to make an appointment to really go over your situation with her. That's the best thing you can do. 856-489-0505. And remember, the initial consultation is complimentary. Also, check out the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Also want to remind you, as you heard Dr. Molly say, we have the Health Watch replay, Sunday afternoon, 4 to 5. So we call it sometimes our sleeper special. You want to sleep in on
especially
Sunday
a day
morning.
like this.
Right, you want to sleep in, okay. You didn't miss the show. You catch it from 4 to 5, all right? Health Watch replay every Sunday right here, Talk Radio 1210 WPHT. You have a question right now for Dr. Molly, 855-839-1210, our number here in the studio. Dr. Molly, I know you want to wrap up kind of what we were talking about before the break.
Appreciate it,
the PSA, a cell search. What are all these things about?
So here's the thing. The cell search is called the circulating tumor cells. And what they are is the cancer cells that separate from the primary cancer tumor, and they travel through the bloodstream or the lymphatic system, which, by the way, is very, very important, to other parts of the body. The number of these circulating tumor cells in a patient's blood sample correspond to the overall patient progression and survival if they're doing any kind of treatment or whatever, or an indication of a patient's response to treatment, whether you want to do treatment naturally or conventionally. And again, we have a consulting oncologist that I talk to when I have a patient in our care for the supportive care. So this kind of testing is important. The free PSA test, this is another one. This is an algorithm. It is based on the patient's age. It's based on the PSA, which is a particular protein that they're looking for, particular antigen that men have when they have prostate cancer. So there's an algorithm that's been developed over the last probably 10 years. So it's a really good algorithm that shows a patient, depending on their age, the likelihood of having a prostate cancer. Why is that important, John? Because how many guys come into us with enlarged prostates and they're benign, right? They're benign. But if we see that their free PSA for their age is elevated, we're going to get them right over to a urologist because we know there's a good chance that something else is going on, and we're probably going to run the CTC, which is the tumor cells, right? The cell search for the tumor cells for the prostate cancer. So do you see that how these things go hand in hand and why it's good to help us help a patient get to the right specialist if they need to, get to the right course of treatment, whether they want to do no treatment, like one of our wonderful friends says, one of the wonderful friends of the clinics tells us, or they have already had treatment and maybe it's failing.
Are these things covered by insurance, these tests?
Well, the free PSA may be covered. The tumor cell test is probably not going to be covered because, again, they took it off the traditional clinical labs.
Because they weren't getting paid enough.
They weren't getting paid enough.
Yeah.
But, we try to make it reasonable. We were sending it out to Europe, which was very difficult. But I've actually done research now and found a company that I can trust the technology about. And I'm going to try to add that to our test list by June 1st. So the thing is, the one thing I want to say about us is we're always evolving. There's new technology. Wait till June and July when you guys start to see what else we're doing with our stem cells. I mean, everything is always evolving, whether it's for pain, whether it's for cancer, whether it's for autoimmune, because our whole focus is what? It's on keeping somebody's quality of life, no matter where they are in a continuum for a particular challenge. Doesn't matter. If you come in and you're perfectly fine, we have new technology for you. If you have a little pain, a little inflammation. If you come to me with a challenge like cancer, like Lyme disease, post-Lyme, like some other autoimmune. I have a wonderful patient right now who has the rheumatoid, very, very severely rheumatoid. I'm looking at all new things for her that actually have a history of sorts that can help a patient through this maintain their quality of life.
Question about the PSA.
Yes.
How often should men get that, or when should they start getting it?
Well,
and how often should they get it?
You know what? I believe men should start getting it by 40. I think there should be a baseline. Really. I mean, listen, guys our age, right? Meaning my age, your age.
Yes.
You know what? Every one of them have a problem, always talking about having to get up in the middle of the night, right, to urinate, to void. Why? Because the prostate gets enlarged. Listen, folks, age takes its toll. The idea is, come on into our clinic. We might make you somewhat ageless. Keep those things in check.
Is this part of the men's health protocol?
Oh, absolutely.
Okay. That's what I
absolutely.
thought. Okay, so that's something you may want to consider.
Of course.
So then you get everything.
You
right?
get a whole lot.
Right. Okay. It's
Thank you.
like the full menu, right?
Yeah. Listen, you know what I don't like? I don't like when someone comes in and thinks we're a Chinese restaurant.
Yeah.
I only want A from column A, one from column. Nah, we don't do that. When you come into us, we put together a full program, whether it's the thyroid that needs to be reset, whether we have to look in addition to why you're having the pain, why we might have to send you to somebody I know who's a pain management guy. I mean, all of these things are important, John.
All right, let's go to the phones. Tony is in Port Richmond. Tony, good morning.
Hi, Tony.
Welcome to Health Watch. You're on with Dr. Molly.
Hello. Good morning, Dr. Molly.
Hi.
Yeah,
How are you? I don't like that
not
groan.
Real good this morning. Not real good this morning.
Okay.
I'm a 70-year-old man, although people say I don't look that old.
How old are you again, Tony?
70.
70? 70,
70,
right?
yes.
Oh, yeah, you're young, honey.
Yeah, I've had, but I ache. Every joint in my body hurts.
Yeah.
I'm tired. I have no energy.
Yep.
I have difficulty focusing. Now, I've only had one of those yearly exams, and I was very disappointed with the results. There was really no explanation. I've been an engineer for 40 years, and
God bless you.
Research
Good.
is my game.
Good.
But I need to really get a good checkup. I'm not feeling good. I can play golf once in a while, but then I'm practically crippled for 2 days.
Oh, you know what, Tony, come in to see us. Just come in for the free consult, but come in to see us. For all you know, it could be a very simple fix. It could just be thyroid problems, right? It could be a couple of things. It could be the thyroid. It could be a little bit of arthritis that's starting that we can help you with through some IVs.
Definitely arthritis.
Yeah,
Definitely
yeah.
arthritis. I'm
But
already on pain medication.
You're
for
on
that,
pain meds. What type of meds are you on, Tony?
Oxycodone. But I'm a poster boy on it. I mean, I only take it when I need them.
God bless you.
I have I'm not an addictive personality. I didn't get to be this age by being an addictive personality.
Right.
But
you know what?
They're no longer helping me. They're no longer helping me.
I believe that. In fact, I can tell you a recent study that said in many times because of how it affects certain receptors in the brain, okay, although it's supposed to control pain, and it does. It can control pain. It can give you a whole list of other issues. You know what? I would love to see you. I think we could help you. We would start, of course, with some blood work. We would also start with a good exam. I think you would love my internal medicine gal. She's great, and we would sit with you and go through anything. Have you taken any oral or any type of vitamins or any kind of supplements for the arthritic condition?
Not specifically. Well, I have tried various things. They don't work. Right now, the thing that seemed to work the best is I've been taking whey protein for about 6 months.
Smart.
And that tangy tangerine, which is wonderful, loaded with all kinds of vitamins. I take that every day. And then my vinegar, my ACV, and
you're taking
honey.
good stuff. You're taking good stuff. Now I have a honey that'll knock your socks off. You need to come in and see us. I can fix this up. You are taking the whey protein. That's very smart because I'm glad to hear it isn't soy protein. You're a smart guy. You obviously have done your research, and I think we could help you. It's a question of tweaking some of the vitamins that you are taking and maybe an additional couple. And I think a short course of the hydration therapy with an appropriate amount of the anti-inflammatories and also looking for certain anti-inflammatories in your lab results would help. And I would also say to you that some of the peptides, which I'm going to talk about, which I'm sure you're familiar with because you play golf, you knew about the whey protein, this kind of thing. There are certain peptides that work on certain interleukins, right, and the cytokines, which are cell signaling kinds of things that can help you. And indeed, we use them through the hydration. And, come in and I can talk more freely if you know what I mean. Come on
Tony, thanks a lot for the call.
This is a great call. How soon can I get me? You have to call Fran today, but I'm sure I could get you in this week. You sound like you could use a good consult. Come on in.
If
You're
you come
a good
in
man.
Tuesday or Thursday, then you'll see me there, okay?
Yeah, absolutely. Okay. Hey, Tony, thanks for the call.
Thanks for the call, Tony. Appreciate it.
You know what? I really appreciate a guy who's done his research. I like that. I love engineers because they're accurate and precise. They know exactly what's going on. And you see, he's already started. He looked at the orals. It's a question of tweaking it in an appropriate amount and getting him where we need to go.
Yeah, that's really a good patient for you.
Yes, absolutely.
Because he's kind of done some homework before.
He knows it.
Right,
he knows
it.
it.
Okay.
He knows it.
Coming up on our final break of the morning, which means we still have time for calls if you have a question here. 855-839-1210. You have a question for Dr. Molly or a medical challenge you want to run by her, 855-839-1210. Health Watch is the show, Sunday 8 till 9, Talk Radio 1210, WPHT. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return, more Health Watch after these words. We're back here on Health Watch. Here's the number. You want to write this down, 856-489-0505. Of course, when we leave you at 9 o'clock, operators standing by at Innovative Medical. You want to call and get more information? That's what you do. You know, you got the whole day because the operators are there all day. 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. That's the website. And don't forget, if you missed any of this morning's program, we have our Health Watch replay every Sunday, 4 till 5. Right here on Talk Radio 1210 WPHT. Health Watch is the show, Sundays 8 till 9, the live version right here on Talk Radio 1210 WPHT. Let's go to the phones. Ron is in Haddon Township. Ron, good morning.
Hi,
You're
Ron.
on with Dr. Molly.
Yeah, good morning. How are you?
Oh, good, good, Ron. How you doing, sir?
I'm doing fine, thank you.
Good, good. How can we help
I'm
you?
calling about my grandkids. I got a 15-year-old grandson,
Okay.
and he had some issues years ago, and he's kind of way overweight, and I was wondering if you could help him out. Plus, he has an asthma condition and things like that, and he was in a hospital when he was a
my God.
baby, and he was, in serious condition. He was in a coma for a month or two.
Oh
so,
my God. Where did
Yeah.
you take him to Children's Hospital or was he?
Yeah,
Was he? Oh,
yeah,
good.
well, yeah.
Thank
We
God.
went to Children's, but then we wound up at, I think, Virtua, because Children's Hospital was so backed up at that time.
Yeah.
They were just.
Oh my God.
There was a
my
long
God.
wait, and
I know.
the doctor that took care of him really, really did a job, because it was. I can talk more in detail later on, because I'm going to call you and make an appointment.
Good. Come on in. Let me tell you what generally. Now, I don't know whether we would want to do some hydration on him. I'm very interested in the case, though. Generally, we don't start kids until they're around 18. But it sounds like this is a very interesting case, because it sounds like he has some dysregulation. Obviously, if he has asthma, he must have had a lot of testing done, like for antigens and things that he was possibly allergic to. And I'm also interested if he ever had anything related to environmental issues. Do you know that, sir? Do you know that? Environmental.
I'm not
meaning-
sure, but I can get more information when I make the appointment with
I
you,
would
and
like
we can
that.
go over a lot of
Yeah,
things.
that would be great, sir. Really. Yeah, sure. Come on in. We'll try to help. I try to help. And believe me, we may not be the place for him in the long haul. You might come in for a visit with Dr. Vivian and myself. But what we might do is send him to some people that we know, some specialists. But I want to get you to the right guy. I want to see the paperwork and things. Okay?
Yeah,
How's that?
Yeah, Ron, make that appointment.
Yeah,
In fact,
Ron, you sound like a really good granddad. Let me tell you.
What I would do now, Ron, hang up and make that call to the operators and make the appointment. I would
Thank
do that
you,
right
Ron.
away.
Thank
Okay?
you. It's a good
Thanks
good
a lot
case.
for the call.
That's a very interesting case, because there's more going on there.
I know you didn't forget this, but you were talking about a young person who was not 18
Yeah.
years ago. Michael, remember?
Oh yeah,
Yeah,
he was another one.
He was
I
like,
did do him.
You did.
I got to
You
say,
saved his life. You
He-
saved his life.
I
Come
know
on.
I did.
I know you're humble.
No,
but you did save his life.
I didn't save his life. Our whole team
Yeah,
saved his
you
life.
did.
I know
Yeah,
about the
yeah.
case. And yeah, what happens is I get interested. Technically, we are a primary care facility that treats adults, but a lot depends on what the case is, because certainly would help. And that was another grandfather who was so smart. He was a lawyer.
Yeah.
He was so smart. He gave me 10 banker's boxes of paperwork that my docs and I went through. I thought my doc was going to have a conniption.
Yeah.
But
You couldn't walk in your office, by the
No,
way.
but you know what? We went through it. We did a round robin. We actually did a rounds on that particular case, where we each had Barbara, God bless her. She took the entire file, 10 boxes, John. She had them all separated out to piles for both the doctors, myself, and her, so that we were able to do a round robin and discuss the case. I have a sense this might be a case like that. That's why I said I was interested.
I
I'm
could see-
surprised.
I could
I'm
see-
surprised that you bringing that up, John. Yeah, that's
could-
exactly what.
But I could see
The wheels were turning.
The wheels were turning, and I'm thinking,
Oh,
I remember.
she's- yes.
I remember.
I'm very
because
worried.
That case, I'll tell you, just for the people to understand this, you would talk to me about cases before we did the radio show.
Right.
And you said, look, I'm going to let you look at this patient, but I have him in the room on the side where none of the other patients can see him because he looks scary.
Yeah, he did look scary.
And so I remember, and I looked in and I went, oh, my God, and I really felt bad.
Well.
And now the kid is doing great.
He's a lawyer.
He's a lawyer. He graduated college. I mean,
Right.
but you did save his life, and hopefully this is not that serious.
I hope so. I hope so. But
I know you get interested in
It
these
has the
things.
same kind of thing because Michael had an issue with that was very simple in the end, and he was on a lot of medication that was all contraindicated, and it was a question of separating stuff and having the right parental group who said, listen, we're going to put faith in your doc and you, and we're going to move forward with this, and then getting him to the right people, which we did. He actually had a feeding tube, that poor boy.
Yeah, that was a shame. Well, I'll tell you what, we had plenty of things we wanted to talk about. We didn't get to them, but we'll get to them next week.
Okay,
Here on the
sure,
show, okay?
sure.
Because we really are kind of out of time, so we can't start something new.
Okay.
But- sorry, Dr. Molly.
I would like to, but
It's-
okay.
It's called the clock in radio.
I know,
You
I know.
can't go against the clock.
Well.
That is going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at 856-489-0505. That's the number for Innovative Medical Associates, Marlton, New Jersey. You want to check out the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget our Health Watch replay this afternoon from 4 till 5 here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful D, fabulous Fran, and we have Joanne, and we have our nurses, Jess and Crystal, and of course our medical assistant, Chatty Cathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a great and a healthy week. We'll do it all over again next Sunday. Health Watch 8 till 9. Talk Radio 1210 WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or